Thank you everyone for tuning in today on this Sunday afternoon. Allow me to share screen so that I'm able to show you my slides. Okay, so I'll be taking you through the body of work that has been done, exploring the various themes of mental health in the era of COVID-19. And I think as Angie has mentioned, COVID-19 is really an unprecedented crisis. A year ago, even 7-8 months ago, we would never have foreseen ourselves in the situation in which we now are. But well, here we are. We are now about 7 months in, and humanity as a whole is facing many challenges. And these challenges are not just confined to the virus itself, but also the various ways in which the virus is changing our lives. I mean, the very fact that we're having this conversation over this platform, I think, says it all about how this virus has changed our lives. So the facets of today's talk are basically threefold. First of all, I'll be looking at the effect of illness contagion or illness spread on the broader public's mental health. So I've termed this the worried well. Number two, the effect of quarantine on mental health. And number three, it would be the mental health in the post-COVID-19 world. Before I go on, let me just qualify that a lot of the data I've brought together is global, doesn't really specifically pertain to Singapore. I think so far in Singapore, we've done a very good job in terms of being able to control our community spread. And with the various stimulus packages and so on that have been released, somewhat being able to cushion the economic impact of the virus so far. But we are highly plugged into the rest of the world, and we see unchecked viral spread in so many countries, you know, in India, Brazil, the US, that it does make one wonder whether these issues might someday come to affect us a little bit more. It's good to talk about it now, hence the talk today. So part one would be the effect of illness contagion on the public's mental health. So I've termed this the worried well. People who do not yet have the virus, but are naturally worried by what it means. So this is from a paper that's published in the Asian Journal of Psychiatry earlier this year. It basically theorizes that for every single spike of COVID-19 cases, and it's likely that we will have multiple spikes of COVID-19 cases around the world, that you have two peaks of mental health problems. The first peak happens soon after the virus makes its presence felt and cases rise. And so there's understandably a lot of fear, there's a lot of anxiety, people that will be struggling to adjust to the new normal. We call this the adjustment disorders and obsessive compulsive disorders as well. But then humanity, we're a resilient bunch. And so eventually societal resilience will kick in and people will adjust to the new normal. But then, unfortunately, we know that the virus does lead to a loss of life, but not only that, loss of jobs and various other things. And so eventually over time, people may then develop a second peak of mental health problems. And this would be more related to loss and grief. So we're talking about grief, post-traumatic stress disorder, depression, and suicide. And I think one of the concerns that was articulated in this paper was that the number of cases of people who may suffer from mental health problems may be far in excess of the number of actual COVID-19 cases in the population. And this may go beyond what a mental health care system is able to manage. So COVID-19 and distress. So I think as we have mentioned, it is an unexpected, unprecedented unknown. We still don't know all that much about the virus. There is a lot of uncertainty still about the rate and mode of transmission, and there's unparalleled spread, no definitive treatment at this point. And there is a greater psychological fear than during SARS. I mean, one thing's for sure, it certainly hung around a lot longer at very high levels than SARS did. SARS came, it caused a lot of problems, no doubt, but it did go away. I don't see the same thing happening in COVID-19. There is a substantial psychological impact. About more than half of respondents from a study in China actually reported moderate to severe psychological impact. And the fear of COVID-19 increases levels of stress, depression, and anxiety, and in turn reduces the level of life satisfaction. So why might this be happening? Part of it, of course, is related to the virus and the nature of the virus and its spread, but also the fact that today we live in a very polarized world. If not Singapore, at least in the rest of the world. You look at the US, for example. And so media coverage may actually amplify anxiety, There may be a lot of distrust towards governments and healthcare authorities to control the spread. I mean, if you watch the US news, you would see that this is very much in play. There may be a lot of stigma and blame towards individuals who are deemed to be spreading the disease, and also a concept which I shall go on to explain called the behavioral immune system, which I'm going to talk about a little bit because I feel it explains a lot of things that we are seeing today. So the behavioral immune system, we know that we all have an immune system. So this is what kind of kicks in if we get infected by any bug. Our body mounts an immune response. But it isn't just the cells in our body that produce this response. It's also something that's seen in our behavior. And what this immune system is meant to do is it's meant to protect us against potentially getting infected, and so to reduce the work that our body's immune system then has to do. So, and the degree to which we activate this immune system, this behavioral immune system, really depends on how vulnerable we feel to the disease. Coming back to a point that we see across the world, you might see a lot of young people congregating at bars and going to malls and queuing up at restaurants. You don't necessarily see people who are more elderly doing that. And that might be because the elderly might perceive themselves to be more vulnerable to the disease, and they take steps to protect themselves far more than younger people who may view themselves as being innately immune might adopt these steps. So what are the benefits? Well, first of all, it creates vigilance of one's external environment, and it values conformity and obedience over eccentricity and rebellion. So these days, if let's say there is a lockdown or there are restrictions, social distancing and so on, we tend to follow because we are worried about the virus. And sickness behavior in itself, when someone is sick, they don't go out as much generally. They adopt social withdrawal and a loss of energy, may actually help to limit the spread of the disease. And that's a behavior in itself too. And also distancing behaviors from those who are potentially unwell may reduce the probability of catching the infection. And this actually lessens the work that needs to be done by the cellular immune system. However, there are a number of downsides. So first of all, of course, is the fact that avoidant behaviors may actually come at the expense of interpersonal relationships and daily activities. We might go out less, we might talk to people less, we might not meet our colleagues or our friends as much, and we get more distant. It is stressful, so that taxes our metabolic system. You're always in a state of stress, and chronic anxiety and stress can lead to problems. We might stigmatize certain communities. We know of reports, for example, in the UK of Asians being attacked. And the greater disgust, greater activation of aversive cognitions into working memory, and greater motivation for behavioral avoidance. So basically, we view the world then as a more threatening place. We start to adopt behaviors to keep ourselves safe. It might help to keep ourselves safe, but it's not necessarily something that's good for the long term or in excess. So what are the groups that report higher distress levels? And this is from a collection of papers from around the world. So female gender has been shown in a number of papers to actually be a group that is associated with higher distress levels. Respondents aged 18 to 30 and above 60. So above 60, I think it's, perhaps because they perceive themselves as being more vulnerable to the disease. And for respondents aged 18 to 30, remember, these are young people. Their studies may have been disrupted. Entry into the workforce may have been disrupted. They're just about earning their first paycheck. They may be struggling to support themselves. So this is a very stressful time for them. Students and migrant workers, not surprising that they would be under a fair bit of stress. There is higher distress in places with inadequate public health resources and limited containment measures. If the virus is spreading everywhere and there isn't a hospital that you can go to, then you are going to be very distressed by the fact the virus is there. Those with poorer self-rated health status and with medical problems will have higher distress because they have perceived themselves to be more vulnerable. And having an acquaintance, a family member who is infected, especially a family member who's infected with COVID-19, can be stressful as well. You might worry that you might catch the infection. There's caregiving responsibilities that one might have to take up. And of course, there's that worry, what might happen to my family member? So part two focuses on the effect of quarantine on mental health. I'd first of all like to qualify that it's very hard to exactly differentiate which aspects of mental health distress are due to the virus and which aspects are due exactly to quarantine, because the two are so closely interlinked. But nonetheless, I've tried to look through the data to kind of provide an overview on it. So the effect of quarantine. So, I mean, it's needless to say, I think we're all aware now that the distress from pandemics not only stems from a fear of the disease, but also from the effects of quarantine. Quarantine measures may worsen anxiety. It can cause boredom, anger, and loneliness. We might feel cut off from our social contacts, and this can be stressful. When you're at home all day, perhaps not able to further one's studies or do the things that one might normally do, it might affect your self-esteem. Boredom and stress might affect one's ability to exercise self-control. It affects sleep quality if you're in the house all day, and it increases the rates of depression and post-traumatic stress disorder. There was an article in the Guardian newspaper in the UK that actually said that 1/5 of vulnerable adults in the UK actually considered self-harm during their coronavirus lockdown. Distress related to quarantine is associated with inadequate information, inadequate supplies, and a longer duration of quarantine. I think during our circuit breaker period, you may have heard of Minister Lawrence Wong talking about why it was important to time the onset of the circuit breaker properly and not have it for too long because you're worried about population fatigue. And that's a very real thing. And the longer you keep a population locked down, that can have a lot of problems in and of itself. Quarantine and national lockdowns actually have a profound economic impact as well. And this may actually cause a rise in unemployment and financial stress, which in turn may increase the risk of suicide. So with that, I've actually collated the literature to talk about some of the pathways from quarantine to suicide. Now, I must emphasize that not everyone who is quarantined is at risk of suicide. And it certainly is not something that happens, it's not an inevitable progression. But it is a concern, and I think we need to bear it in mind because it's best to prepare for a problem rather than react to it. So first of all, it's important to remember that there are certain groups that are at higher risk of suicide, mental health distress and suicide when under quarantine. So they're basically people who endorse being lonely, those who are living alone, those who are single. And certain behaviors that might increase one's distress. So more time exposed to news on COVID-19, if one has fewer positive emotions, you have less perceived self-efficacy, so you don't feel you're that capable of doing things, and you feel almost vulnerable to the quarantine. Lower quality of sleep and negative self-perceptions about aging. So these are some of the risk factors and some of the pathways. So basically, quarantine is a very isolating experience. And this can result in a sense of thwarted belongingness. So this is from the interpersonal theory of suicide. So the person may feel separated from the group to which they normally belong. So for example, if they feel they belong to a certain church congregation, for example, or a certain group of friends, now they're not meeting them anymore. So they lose this sense of belongingness. There's also that loss of social interactions. And with that, there is a sense of diminished mental health well-being. There's also the very real problem of poorer sleep. Abuse is a problem. I think the World Health Organization issued an advisory about the fact that global rates of domestic abuse were going up during the period of quarantine. So this is a very real concern, and victims of abuse are likely to manifest diminished mental health well-being. There also may be a feeling of being trapped and the economic consequences, which will be stressful. So all of these things together may potentially increase the risk of suicide. And the reason I'm bringing this up is because proactive interventions are needed to assist those under quarantine. So things to counteract the effects of social isolation, to shelter those who are at risk of abuse, to basically reduce the economic consequences of quarantine. So these are things that need to be looked at. So approach in therapy, I think I'm just talking about this more because later on I'm going to talk about the importance of self-therapy. But these are some of the cognitive processes that I think we can have in mind in order to kind of buffer ourselves against the mental health impact of quarantine and of the virus. So first of all, it's important to realize that virtual modalities are more practical at present. Yes, face-to-face would have been good. It would have been nice to meet your friends, would have been nice to meet your therapist, but right now that may not be all that possible and not be the safest. It's important to address the reality that we live in extraordinary times. It's also important to reassure the patient in the event of a therapist, or how one would a friend, that there will always be, the person will always be there regardless of the crisis. It's important to maintain eye contact and, basically to suggest using virtual platforms like Zoom or FaceTime to maintain contact with one's social contact. So have a Zoom dinner, for example. It doesn't mean just because you cannot meet that social gatherings have to stop. And for those in therapy, it's perhaps perhaps important to bear in mind, now may not be the best time to terminate therapy. It may be good to continue it at least till this crisis is a bit better. And to reframe, to look at the pandemic not as the end of one's old life and the kind of the end of everything, but as a role transition, a change in which the person, yes, mourns the loss of old roles, but then you adaptively restructure activities and relationships in this new normal. So use it as an opportunity to start anew and to adapt and to adjust. Other interventions, so I talked about digital technologies and how important they are. Places of congregation should actually replicate their activities via online platforms. So this is like places of worship, gyms. Employers should actually create a buddy system and ensure a daily reach out to employees. Routine creation is essential, especially for children not in school, to kind of give them the rhythm and routine. Mechanisms for surveillance and decisive intervention in cases of abuse must be created, basically so that the victims of abuse who are now back in their homes, often with their abusive partners, must have places of help and shelter. And that really leads me to my next point. These shelters in and of themselves must be safe, must have social distancing so that this vulnerable group doesn't itself become infected. Mental health system actually needs to be bolstered in anticipation of a surge of cases, which may happen. And telehealth may need to be expanded. And communities should be encouraged to create informal support networks amongst themselves to provide support to each other. How to help the helpers? Well, basically, I've talked about this because I think we all recognize that, I'm not sure, I think many of us may be therapists, we may be caregivers, and it's a stressful role at this time to care for others. So how does one help the helpers? So, basically it's important to have a proper diet, regular exercise and sufficient sleep, clear communication, basically providing the psychological and financial support to those who are in caregiving roles, and psychological first aid, which is the main reason why I'm actually talking about this. So if you look at that box to your right, you'll see that these are the themes of psychological first aid. It's something very simple, and basically the main focus is to emphasize to the person to whom you're giving this first aid that number one, they're safe. Number two, that they're not alone. Someone is there to link them up with supports so that there can be more support in the days to weeks moving forward, and to provide them with information about how to cope and how to manage their distress. It's useful because it's very applicable in this time. And psychological first aid is certainly something that I think is a good tool for a lot of people to learn. Much as we learn medical first aid to deal with people who are going through a medical crisis, psychological first aid should be something that should be taught to help people who are going through a psychological. And since this is a mindfulness workshop, I thought I'd include something about mindfulness as well. And there are some studies that have talked about mindfulness in a pandemic. So focused attention, mindfulness-based cognitive therapy, and mindfulness-based stress reduction have been shown to reduce anxiety, depression, post-traumatic stress disorder, and the physiological markers of stress. They basically offer a helpful way to cope with this constant change of a pandemic, rising cases, lockdowns, and so on. Daily mindfulness practice actually improved sleep duration and reduced anxiety amongst the population of quarantined individuals in Wuhan as compared to those who just had mind wandering. So basically just kind of unfocused attention and rumination. A qualitative study of nurses in China actually showed that they endorsed mindfulness as a helpful way of reducing stress. We know that nurses are under immense stress these days in a lot of countries where the cases are, surging. And meditation and mindfulness apps may actually be helpful in order to deliver this mindfulness to the broader community. And mindfulness micro practices can be used to promote wellness and reduce burnout. Example, whilst performing hand hygiene. So now you may have heard a lot about washing your hands and so on. So whilst washing your hands, how about practicing using that moment to focus on one's breath, center one's mind and body, and visualize the kind of calmness and presence that one would want to have at that moment in time. So while cleaning your hands, how about also kind of focusing on cleaning some of your thoughts and kind of promoting that wellness and peace. I know it's abstract, but it's perhaps something that can be elaborated on further by other speakers, or maybe even during the conference itself, about how these micro moments can be used to promote wellness. So part 3 is about mental health in the post-COVID world, and I think that really is a question that's foremost on many people's minds. So we talked about the COVID cycle. So COVID cycle, I think as we are all familiar, you have a rise in case numbers, there's a lockdown, case numbers drop, and then there is a gradual reopening of society. But unfortunately, then case numbers rise again. And whilst not linked, in the Ebola crisis in West Africa, in Liberia and Sierra Leone, they actually talked about the presence of a fear-apathy cycle. So where Ebola cases rise, there's a lot of fear, but then Ebola becomes a new normal, and then there's apathy, and then cases rise again. And they talked about this in terms of how aid agencies may sometimes render support to, or governments may render support to people affected by the Ebola virus. There is somewhat a similar trend seen with COVID, at least in quite a number of other countries overseas. And this is from The Economist that basically kind of sums up this whole COVID cycle and how there is this pattern of re-engagement followed by a spike of cases and then unfortunately shut down again. So what are the possible socio-economic scenarios that COVID-19 might have? So first of all, of course, borders may actually remain far more tightly controlled than before. You may have countries that may have as an aspirational goal a mere suppression of the virus. So some level of spread, but fairly low, versus countries that may say, well, we want to eliminate the virus. So countries like New Zealand or Taiwan or South Korea. And is it likely that a country, having taken all that effort to eliminate the virus, may then open its borders readily to countries that merely state as a goal their desire to suppress? So this is a question that might be seen in the months to years ahead. There's also a concern that, jobs with short-term contracts may become more commonplace as employers are unable to plan for the long term, and this might result in a transient workforce. And governments may need to institute a series of stimulus packages to support the most needy, but this may be associated with an increase in spending, and so tax rates might go up, and you wonder if future generations might actually have to foot the bill of all the stimulus packages of the present day. At least in quite a number of other countries that don't really have the reserves that Singapore do, this is a particular concern. There may also be sizable disruptions to educational progress. I think school closures and online learning is important, but can it really substitute actually going to school? Financial strains may actually force younger people to forego higher education in favor of earlier work. Communal activities and large-scale social events may not occur as freely as before. And unfortunately, as we know, it's human nature, certain entities may stir feelings of ill will towards certain countries and communities. And as we know, if history is any guide, the ensuing friction may lead to global conflict. We hope it doesn't, but if past pandemics and crises have shown us anything, it's that for every good reaction that mankind seems to do, there is also, unfortunately, a negative reaction as well. So what are the mental health consequences? And I've divided this really looking at the spectrum across the lifespan. So I've talked about an increase in domestic abuse. So this is likely to affect the young and the elderly the most. But there may be other issues as well in the young. So I think Prof. Daniel Fung will be talking more about the mental health impacts on the young. So I'll be brief here, but basically there may be a rise in adolescent mood and anxiety disorders, due to stalled educational progress, dim prospects, unemployment, and the lack of social interaction. And that may result in an increase in adolescent suicide and an increase in delinquency. In the elderly, we know that many elder care centers have shut. And so this is, because you do need to keep the elderly safe from the virus, but then that creates increased social isolation. And many people, the younger folks, may be familiar with Zoom and online platforms, but our elderly may not be so familiar. And so they might really, really be cut off. As was seen actually post-SARS, there was actually an increase in elderly suicide driven by disconnectedness and fear of contracting the illness. And this was seen actually in Hong Kong post-SARS. So this is something that we need to bear in mind. Across all ages, we are still finding out more and more about the direct impact that the virus has on the brain. We still don't know all that much, but there is a concern that it may be causing some behavioral changes in people who are infected. There may be adjustment disorders, depressive disorders, grief, OCD, and post-traumatic stress disorder may rise across the board, and anxiety disorders may become more common. And as was seen in West Africa after Ebola, there was actually an increase in the rates of addiction, especially to alcohol. So this is something that we also need to think about and plan for in the future. And so for the mental health care system, I suppose it's important for us to look at the groups. Yeah? So I've divided it based on the various groups at risk. So for the worried well, those who are worried about contracting the virus but do not yet have any mental health mental illnesses at this point, you may want to talk about increasing the outreach of mental health apps, familiarizing oneself with their use. So this would be self-help, cognitive behavior therapy, or mindfulness. We want to integrate mental health advice into pre-existing social media networks. So maybe reminders on Facebook or Instagram in order to kind of ensure that they're well, or check in on their friends to make sure that they're well. And also having support groups in the workplace, as we've talked about before. For those who have mental health illness symptoms or some stress but do not yet meet the threshold for an actual disorder or illness, then they may help from counseling services and increase in the scope of telecounseling services that might be helpful. For those who have mild to moderate mental illness, then I suppose having easier access to psychiatric services or scoping out your telepsychiatry services may be helpful. And for the very ill, I suppose it's the one major thing we need to think about is how do we get them back on their feet as soon as possible after they've had a period of illness, especially given the slightly more dim employment prospects that would be there as a result of this virus. So my reflection, and this is my last slide, is, much has been said about hand hygiene, washing your hands, wearing a mask to stem the spread of the illness. But what about psychological hygiene to stem this emotional contagion, the spread of stress and of distress? Mental health effects of COVID-19 are likely to linger within society long after the virus is suppressed because the economic after effects will not just go away the day a vaccine is found. It will be there. And talking about the vaccine, much as a vaccine will inoculate or protect people against the virus, perhaps we also need to think about a vaccine for emotional wellness. Perhaps this will involve teaching people how to practice mindfulness or cognitive behavior therapy on their own to manage stress, teaching them how to have proper sleep hygiene, for example, or how to talk about their feelings, how to recognize mental illness. That's important too. And telemodalities will be important in this way. So that will allow people to reach out to each other. And eventually, once the whole of society is aware of what mental illness is aware of how to help oneself and how to help those around us, then perhaps we would have built up herd pandemic-related stress. And that's perhaps something that we need to build ourselves towards. Also, it's important to remember that societies do have a responsibility to act collaboratively and manage the spread of hate and division, which may happen, but we must actively work to prevent this from happening. So with that, that brings me to the end of my presentation. Thank you for listening.